Hello and welcome to Health Professional Radio. Thank you so much for listening with us today. Our guest in studio today is Dr. Joseph T. Berry, certified in both internal medicine and geriatrics, received his medical degree from the Downstate Medical Center in Brooklyn, New York. And Dr. Berry believes that you should treat the entire person and not just the presenting problem. His interests include chess, reading, old movies, hiking, as well as a long-standing interest in the martial arts. And he also writes a column for Table Hopping each and every month. He's here today to talk with us about some of the studies that indicate how much better highly personalized preventative care is in achieving much better overall outcomes and less hospitalizations. How are you doing today, Dr. Berry?
I'm doing fantastic.
Thank you so much for joining us today. When it comes to traditional medicine as opposed to personalized care, or as some might call it, concierge medicine, you've been a practitioner of this type of medicine for a short time now. What type of response have you received from your patients as you transition from a traditional practitioner to a personalized caregiver?
Well, the ones that have chosen to make the transition with me love it, because instead of 10 or 15 minutes with my face half pressed in the laptop, we have time to sit down, discuss their illness, whatever that might be, discuss their major health issues, and then move on to work on an ongoing basis on their wellness, on what are they doing with their lifestyle, which to me is the most important thing a doctor can work on, lifestyle.
Now,
that trumps all the medicines there are.
If other healthcare professionals who are listening to this program today are considering such a jump, or even maybe the same jump, what would you say to them as far as the pros and cons? You said that those patients who chose to make that jump, of that leap of faith with you, what were some of the opposing points to your transition?
Well, the people that decided that spending the extra money on their health wasn't worth it were mad at me, because I didn't abandon them. My practice with Signature MD, my concierge consult, was such that I told people, I'm never going to abandon you, but I'm now going to have my nurse practitioner do most of your care, and I'm going to be involved as I'm needed. Instead of working alongside the nurse practitioner, I'm going to be supervising her so that I know what she's doing, but I'm not spending as much time with the patients.
Okay.
So there was some resentment by the patients that didn't sign up, and I understand that, and I work with them to say, I will still be here, and when you need me, I will be there for you, but we're not going to have the luxury of a half-hour or an hour visit to discuss what you're doing wrong and right with your diet, with your exercise program, with the stress in your life. Now,
I'm sure that this isn't something that you decided to do on a whim or overnight, as it were. Let our listeners know some of the information that you reviewed before making such a decision.
Well, I knew that I needed a new challenge, and that medicine was coming mundane to me. Not boring, it's just that I was on top of my game, and I was looking for something to go to the next level. And that's when I said, let me look into this concierge business. And I think that most physicians are just afraid of making the leap where they say to people, listen, I'm going to ask you to pay me extra. And when you do that, you're going to get extra services. You're going to have same-day or next-day appointments. You're going to not have to wait a month to get seen by the doctor. You're not going to wait an hour in the exam room. You're not going to get a call back by the nurse. If there's a problem, there's an issue, if you call me, you're going to hear back from me. You need to speak to me at night, you're going to have my cell phone number. So it's a collaboration where we have more time with them, and I think they feel better and know that someone's watching their back, they've got someone in their corner professionally, medically, that's making sure that they do everything right.
Now, what are the odds or the possibilities of the relationship between you and the insurance company and you and the pharmaceutical companies, and, well, you and some of the patients becoming adversarial as far as paying extra money? Isn't that taking away from the insurance companies?
No, the insurance is the same. In fact, I've been able to show the insurance companies that over and over, because I'm a personalized care doctor, I have saved them money. Okay. If you call your doctor up and you tell him you're having chest pain, your doctor is almost certainly going to say, go to the ER. You call your doctor up and say, on the day you want to be seen, you're having abdominal pain, they're going to say, go to the ER. You call your cardiologist and say you're having palpitations, he's going to say, go to the ER. You call your urologist and say you think you're passing a kidney stone, they're going to say, go to the ER. I'm going to say, no, come to me. Let me be the first one to evaluate this. I can do much of the same testing as the ER for a fraction of the cost.
Absolutely.
And I can determine where you should go and how you should get there. I will call the doctor for you, so it'll be doctor level to doctor level, and I'll make sure you get the follow-up you need. I've had people that I've kept out of the hospital. I've said, okay, you have pneumonia, but we don't have to put you in the hospital. I said, come back in 2 or 3 days, and then 2 or 3 days after that. And regular doctors just don't have that schedule. They can do that.
And, most of us are used to just seeing our doctor for a very few minutes, getting a prescription, a couple of instructions from the pharmacist when we pick up that prescription, and basically being on our own until the situation clears up or gets worse.
Well, doctors have been trained for years now. Find a pill. Find a pill. Do a test, find a pill. Do a test, find a pill. Look at diabetics. They go on one medicine, then wait a couple of months, a couple of years, they go on a second medicine, a couple more years, a third medicine. And all that time, what the doctor told them about diet and exercise? Some laughable line like, you should exercise more, you should watch what you eat.
That's pretty dumb.
You can't change behavior that way. If you want to, let's say someone comes in with depression. Oh, here's a pill, come back in 3 months. No one's going to have the depression treated adequately by taking some white pill and coming back in 3 months. You need more time with the doctor. And sometimes the answer isn't a pill. A little white pill isn't going to save your marriage. A little white pill isn't going to make the boss a nicer guy. A little white pill isn't going to deal with the chronic anxiety you've had since childhood. Those require more work. And if you have time, you can do some of that work.
Now, as we wrap up, Dr. Berry, in view of the Affordable Health Care Act, everybody has to keep their insurance, regardless as to whether or not you're giving better care than they would receive from a doctor who's being paid by the insurance company and just spending, 8 or 10 minutes with a patient per visit. How does this affect individuals as they're looking, around for health care, considering their options when it comes to insurance? Are there certain plans that are more insurance friendly, or is insurance friendly even a factor?
For what I do, for the personalized medical care, for the Signature MD program, insurance isn't a factor. If you're a cash payer, if you've got Medicare, if you've got Blue Cross Blue Shield, it doesn't matter.
Right.
I'm going to bill those insurances as I always do for all routine visits. And then the extra money that I charge directly, that's what we do with the counseling and talking about your diet and your exercise and your weight and your anxiety and your insomnia.
All right, great. Now, let our listeners know where they can get more information about Signature MD.
Well, they can go to signaturemd.com, or they can go to my website, Dr. Joe Berry on Facebook, and they'll have a link to Signature MD from there.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Dr. Joseph Berry. He's certified in both internal medicine and geriatrics, and he believes that you must treat the entire person and not just the presenting problem. He also believes that there's a very real and important connection between your brain, your body, and your spiritual self. And we've been here talking about some of the reasons that highly personalized preventative care achieves much better outcomes and less hospitalizations for those patients who choose to take a look at this personalized care, or as some call it, concierge health care. It's been great talking with you today, Dr. Berry.
Thank you very much. Appreciate the opportunity.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.